Now we're going to move on to kind of a different topic. Our clients in the healthcare industry is actually a fairly significant and growing part of our business these days. And we actually have some of our clients, I think, attending today's town hall. We have an interesting talk from Dr. Atif Mohammad. He's a senior research scientist at OnTrak. And OnTrak's focused on A&I applications kind of in behavioral health. He's also an adjunct professor at the University of North Carolina in data science. OnTrak is a technology-based healthcare company. They have a platform that tries to predict kind of whose chronic disease will improve with behavioral change and with recommended pathways for care. And this is clearly a growing area of interest with our healthcare clients, and it's an area that we want to learn more about. And so let's, Dr. Atif, can you unmute yourself, and let's go ahead and spend the next few minutes with you.
Thank you, AJ. You can see my screen?
We can see you.
And we see the
screen.
And the presentation as well.
Okay, presentation, perfect. Thank you. Well, SMA, thank you. Thank you, AJ, Liz, and Alan. Yes, I am a research scientist with NASA, OnTrak, as well as the professor of artificial intelligence. Quite a while ago, around 2 to 3 years ago, I went into natural language processing, not as we talk, rather the messaging within the RNA, which goes and talks to our body internally. So that took me on a whole different path from my actual curriculum, which was the AI and data science and all that. This talk is about the transformational role of the artificial intelligence in treating behavioral and mental health. We all know social determinants of health. If we all don't know it, CDC has tons of material available. It's technically the healthcare system, economic stability, neighborhood where we live, education and food, they all play a significant role. What makes us healthy? The talk makes us healthy as well. The discussion makes us healthy as well. Both internal to the body and external to the body, that we speak with our physicians, with our neighbors, with our friends, over the webinars on Zoom, in a friend circle. However, the standard needs of every individual or a collective or a country or a village or a town goes from family and friends, transportation, the food we eat, and all that jazz that is mentioned on the screen. If you go further, the social determinants of mental health play the main vital role, because in the end of the day, our body is controlled by our mind. The heart is a pumping station which allows the body to function. However, the decisions happen in the mind. Like in DC, we have the decision happen. As we were discussing, I'm really impressed with the first 2 presentations that happened. I really liked it. I'm a Canadian citizen living in States for over 11 years now. So I look at these things as a bipartisan outsider, and I enjoy both plus and minuses. So the war and conflict brings in security. I said insecurity, not the security. So insecurities play a vital role in human health. And I know this is a very verbose presentation slide at this moment. However, the surroundings impact on us, and how we use the artificial intelligence and machine learning to solve the SDoMH issues among us in terms of health. SDoMH, which is the social determinants of mental health, play significant role for us to deal with on the both sides of the aisle, being a patient, being a treatment intervention provider, like a medic, a doctor, and a nurse. So patients' needs and the role of artificial intelligence, as you can see, there is a push that is happening for over 2 decades now. And last decade, it happened on a very big note: personal healthcare or personalized medication. And that is still far to go. However, that has been started in the naturopathic medication area, whereas allopathic, which we use on our everyday, is technically a little far away from that. This year, we have witnessed the warp speed of medicinal ingredients coming in vaccination. And if this speed comes in other resolutions in terms of other issues that we are facing in terms of the social determinants of health application, like where a person lives, what is the population, what is the sample we are picking up to work with, and how our artificial intelligence and machine learning models can assist us. So these are the few algorithms of the artificial intelligence dealing with the expert teams. Those experts are the doctors, nurses, and the healthcare providers. The other experts are the algorithm and model writers or programmers, and the good combination on the guidelines coming in from the CDC, FDA, and all those big departments, which have a collective of scientists, allow us to look into in further depth to find the resolution. Here's a very small example that I have brought in, the AI mental health. This is called gated recurrent unit. I will not go in the technical details. However, there are, as a computer scientist, I only look at 0 or 1, positive or negative. And then as a philosophical point of view, positive, negative, both positive and negative, and neither positive nor negative. So again, false positive, false negative. There is an example. I'm interesting and likable enough. If there is a tweet we'll look into, I don't do well at parties, I'm not interesting. Exact positive, negative, and it can play like I chewed my fingernails and did some skin picking. I know this is a bad thing. I tried doing of the breathing exercises, which worked while I did them. I wrote in my journal until I was tired enough to fall asleep. This is highlighted here. So these are the discussions, everyday discussions. We look at the social media and all those platforms, all the doctors taking in the notes from when the patient visits, all the nurses taking the notes, psychologists, psychiatrists play a huge role. Once that data comes in terms of natural processing of a human understandable language, we can apply the gated recurrent units. We utilize the standard TensorFlow in the Google platforms for these tests at OnTrak, and that's what we do. Here are the few references. I hope I was fast enough to cover this material. AJ, back to you.
Well, hey, thank you so much. That's fascinating. So just to make sure I understand this, you're using natural language processing, applying it to, for example, transcripts during medical visits or tweets or social media to really try to collect data and try to actually perhaps not make a diagnosis, but get an assessment of what the mental health of an individual is?
Yes.
Looking for key terms or key expressions, or other words.
Yes.
Exactly.
Yeah. So a sentence has a pre and post. The pre-discussion and the post-discussion. However, the sentences, when we talk, there are some weights are assigned by the models that we wrote in deep learning, and those weights assess and then predict. And those predictions allow us at OnTrak to engage our members who come from health plans for us to, make them on a better path of their health.
Interesting. So it's
Atif,
a health plan.
Right.
Atif, this is Alan. Can you describe a little bit more about how this has actually been implemented and maybe in a clinical setting?
So since we are an online organization and we have nurses and psychologists and psychiatrists as our service providers, when the members come from, let's say, for example, Aetna or CVS or HAM or Cigna, those members discuss with us obesity, the alcohol use and the substance abuse, the opioid addiction and all that, and anxieties. And so our care coaches or the nurses take down all the discussions. We actually make sure to note down every minor detail. Then with the availability of the public data sets that we have from that certain zip code and certain density, whatever the discussion is happening in that area, we then correlate, our models correlate on the back end, or the discussion between a care coach and the potential patient towards the betterment of that person's health, finding the commonalities, correlating the area-associated social determinants of health, how we can prescribe a bath that takes the person out of that certain bad habit or and correcting the attitude.
Wow, thank you.
Interesting.
Thank you.
Thank
So
you.
we have time perhaps for one more question, and then we'll move on to the next segment. And hey, that was fascinating, Atif. So really appreciate you taking the time with us.
Thank you.
One more question?
I have a question.
Okay.
You know, for probably 4 decades now, there's been this evolution of ternary machines. You mentioned binary machines, but ternary machines, which have the ability to say yes, no, or maybe. Have you looked at that as a way of evolving your model or evolving the capabilities of what you are developing?
Yes. So I have developed a detailed model to extract loneliness.
Mm-hmm.
We were the first one to find loneliness in the discussion happening. Even the person is in the house full, mother, father, and everybody is there, but the discussion is telling the whole different story. And there are people who are, you know, have loved ones, friends, they have social circle, but when they are actually exercising their right of discussion and telling how they feel, they have some sort of anxieties and stress that make them lonely when they are sitting alone. And even if they are in the social setting, they still feel like isolated within them due to some sort of bad attitude that they have opted within the path of degradation of their attitude towards their own health.
Interesting. Wow.
Interesting.
Okay.
Yeah.
Hey, thank you so much. And if there's any other questions, put them in the chat window. We'll try to get them to the end. Great. Thank you, Atif. That was a great talk.